Hello, this is Sabo Katami. I'm gonna be recording the video for the cardio, but before that I wanted to do the room scanning, this side and this side. Okay, perfect. So I just wanna make sure you're able to see it. Okay. Okay. Hi, this is Salva. I'm going to be your FMP today. Before I'm starting to recording the video, I just want to let you know I'm going to be submitted this video in the YouTube so my professor can grade me. Do you give me a consent for that?
Yes.
Thank you so much. Can I have your name and your date of birth, please?
Janie, March 17, 1978.
Awesome, thank you so much. So regarding this video, I wanted to do checking the patients for the cardio and auscultating the patient's cardiovascular system. First of all, so regarding this video for patient privacy, we're not going to be taking out the clothes, but usually we do it. For the inspection on the chest area, we're checking for any thrills, any palpation or any hives or any lifting, which is I'm not able to see it on the patient. I already sanitized my hands, so what I'm gonna be doing, I put the patient in the situation which is like I wanted to check in the carotid arteries and also the pressure, and I wanted to checking the measure of that. The other things is also I'm checking the whole body system of the patient. So the skin is not, I don't see it any bruising, any cyanosis, any discoloration. Also, if the patients have the hair and like especially on the guys is more obvious, so I don't see it any loose of the hair or shiny skin, which is on those area. Usually it means there is no good circulation. And other things is on the leg of the patient, I'm not able to see any varicose vein. So the other things I was gonna be checking, I'm palpating on the fingers, and patients right now have shoes, but I pretend that I'm checking the toes as well, which is we're gonna be checking for the refill of the refill of the fingers, which is should be less than 3 seconds. And the other things is no tarsal or no cyanosis. Tarsal usually for the patients who smoking is more obvious. And also for the checking the patient's skin, it's warm, and as I mentioned, there is no cyanosis or discoloration. So also I checking the blood pressure of the patient in the position of standing, supine, and sitting, and compare it to the right side and the left side, the orthostatic one, and we want to make sure the differences between those is not too much. The patient's blood pressure for me, the average is at 120/80, and so now I wanted to ask the patient, can you please look over? Yeah. So on the 30 angles, so I'm finding the carotid of the patient, the arteries, sorry, not the carotid. So so now I see the pulsation. What I'm gonna be doing, I'm gonna be measuring the measurement we wanted to see. We wanted to have it less than 3 centimeters. So I'm gonna be put this one in the top of this. It's all the way off, and on this one. So the highest point of the pulsation I will see, then I'm gonna be measured at 1.5, which is less than 3 seconds. Also, I'm gonna be checking this pulsation, and here I don't feel it any thrilling. It's bounding and is on the 70s. We usually do right and left side. Either of them, we cannot do both of them in the same time. Can I do the other side as well? Perfect, thank you. So now I'm gonna be listening with the bell and diaphragm of my stethoscope. Bell, diaphragm, bell. So I don't see it any highs or any lifting like in abnormal things. So another things I wanted to see it, I see the sternum of the patient. As I mentioned, we usually ask the patient to take off their clothes. The sternum is midline, and I didn't see any excavitum or a carcinoma, so which is like a bulging or getting inside like a chest area. As I mentioned, there is no lifting or hives. So what I wanted palpation on the aortic, which is this right second intercostal, pulmonic, left second intercostal, herbs, third left intercostal, I'm sorry, triceps, tricuspid. It's third, fourth intercostal, left one, and the PMI or apex is a fifth midline intercostal. Another things is on the apex is a PMI, which is the highest pulsation. You can hear it on that. We can also ask the patient to checking on that to lay on the left side, and from the back we put it our hand and feel it. When I'm touching it, I don't see it any too much lifting or highs. I can feel it, the pulsation, but it's not like abnormal. So another things I'm gonna be doing with the diaphragm and veil of my stethoscope, I'm gonna be go again to the aortic, pulmonic, herbs, tricuspid, and also apex. I'm gonna be checking on that again. Veil, diaphragm, veil, diaphragm, veil, diaphragm, veil, diaphragm, veil, and the last one, apex, diaphragm, veil. Another things I wanted to check it on the patient, I wanted to check in the so like 2 centimeter upper of the belly bottoms and downer of the sternum is the aortic there's a aortic arteries. So on that one, it's when I'm touching, I don't see any hives, any lifting, and no abnormal pulsation. Also I can feel it, I don't feel it any it's bounding but no thrill. So usually I have to hear it, the thrill with the bell and diaphragm. Move my stethoscope. Bell and diaphragm. Perfect. So another area which is we have to check it is the femoral. So purpose of this video, I'm not going to be asked the patient to take off her pants. So I'm just going to be listening to that one by one with the bell and diaphragm, bell and diaphragm. So the next one I wanted to check it on my patient is their pulsation. So what we expecting pulsation, it would be +2, and we want to feel it like bounding, like on the 70s, 80s on the normal patient, and I don't want to feel it any rupturing or any too much hives or like between the pulses. I don't want it to taking longer. The pulses, it should be normal back to back. So the first one is brachial, sorry, like this one, brachial, then radial. So for the brachial and radial, we can do comparing in the same time, but as I mentioned, for the carotid, we have to do one at a time. For the femoral, I'm so sorry for my touch, we do the same, one at a time. All of the one I already checked it is +2. The one, so okay, can I, thank you. So I asked the patient, so that's a puppy toe, and it's +2 again. The other one as well, sorry, +2. Dorsal penis and posterior tibia, all of them are +2, bouncing normal around 70s. And as I mentioned, so about the purpose of this video, I didn't ask the patient to take off the shoes, but I have to ask the patient to take off the shoes, checking the toes for cyanosis, for any and refill the toes one by one. And as I mentioned, a varicose vein, I don't see it. And patient is just skin is moist pink and Color is all even. I don't see any abnormal color. So that's all I can do for the patient. Thank you so much for watching my video.